School vaccination requirements help safeguard children and adolescents by making sure that they are protected when they go to school, where potential for vaccine preventable disease transmission is higher. Now, coming up on Polk Place, we will talk with the Florida Department of Health in Polk County about vaccinations for school-aged children. Make sure you stick around. Welcome to Polk Place. I'm Brian Lacey, and joining me in studio is Nicole Riley. She is a public information officer for the Florida Department of Health in Polk County. Welcome back.
Thanks for having me.
Yeah, so a little bit off the beaten path today. School is winding down, but no better time than the present to prepare for the next school year. So we want to talk school-age vaccinations. Let's start off with the importance of them.
Sure, absolutely. So this is generally a topic that we discuss in August, or late July, August, when we're gearing up, getting ready for school to start. But given how the course of the last year and a half has gone, it's important for us now to talk about parents and families to prioritize getting school-aged vaccines completed earlier in the summer for a variety of different reasons. But we want families to go ahead and be thinking about that on the early end of the summer rather than waiting right before school to go and get those vaccines. The school CDC has a list of required vaccinations for school-aged children. On top of just your routine up-to-date vaccinations. Vaccines, as we know, are so important in preventing different kinds of diseases, illnesses. It can reduce a child or a family member's risk of having additional side effects to potential diseases, and so they make a huge impact on the health of a child, but also on the health of a community, of a family at home. And so it's important for us to encourage those vaccinations early. The CDC has a listing of what the school-aged required vaccines are. And so for parents who either have kids going into kindergarten, maybe they're entering into VPK, or even 7th grade are generally some time frames where vaccinations are required. So, and then just the run-of-the-mill vaccines, just to be sure your child is up to date with vaccines, is important. And so the CDC has listed out what vaccines are important when and what type of schedule the children can be on to receive those.
With over 2,050 square miles within Polk County, one centralized location would be difficult for the amount of residents and school-aged children that we have. But the good news is Florida Department of Health in Polk County has many locations. Talk about some of those locations and the process for going in and either getting the boosters or the initial vaccinations.
So we provide vaccines free of charge for any children 18 years of age and younger. So at our various locations in Bartow, Lakeland, Auburndale, even out in Haines City. And but primary care physicians also provide these vaccines for children. So if your child has if you're with a private provider or a pediatrician, they will be in tune to what your child needs for school. But then we also offer them as well. So there's a variety of locations that families can go to receive those. Generally, getting close to school time too, the health department offers extended hours or certain accommodations to really push the back to school vaccines as well. And so more information will come out on that once we get closer to school time. But there are a variety of locations where parents can go to get that.
It's a two-part question. Talk about the importance of getting these vaccinations knocked out early this summer, because there is something weighing in the future. So let's talk about the importance, and then I'll include with the next question what's weighing in the future.
It's important now, this year, because we've been dealing with COVID for the last year, a little over a year now. We now have a COVID vaccine that's widely available across the county. And as guidance stands now, it's for adults, either 18 years of age and older for the Moderna or the Johnson & Johnson vaccine, or for 16 years of age and older with the Pfizer vaccine. So getting those vaccines early is important because, you know, as guidance stands now, for the Pfizer vaccine, it is available for individuals 16 years of age and older. For the Moderna and Johnson & Johnson, it's for individuals 18 years of age and older. We are hearing that Pfizer vaccine may be available for younger children in the future. We're not really sure what that guidance looks like yet, or what the requirements will be, but as vaccine recommendations stand now for the age groups that are allotted, if an individual receives the vaccine, any sort of vaccine, whether it be flu, you know, the shingles vaccine, or whatever that may be, there's a 2-week waiting period. So, you know, say I go to get a flu shot, or say I well, I wouldn't get my shingles vaccine, but say, you know, I've gotten my shingles vaccine, and I have to wait 2 weeks before I can receive my COVID vaccine, or vice versa. You know, if I've received my COVID vaccine, I have to wait an additional 2 weeks before I receive any other sort of vaccine. We're not really sure yet what the accommodations are going to be for younger children, and, you know, when that will roll out, how that will roll out, but it's important for individuals to get the vaccines on the forefront of the summer and go ahead and consider those things now, so that if those accommodations are opened up to individuals 12 years of age and older with the Pfizer vaccine, then they already have their vaccines out of the way. Again, we don't know what sort of guidance will come with that yet, but it's better to be prepared and to receive those vaccines on the early end of the summer, so that if those accommodations are made, or if, you know, depending on what unfolds later in the summer, then you have your vaccines out of the way.
Got just a little bit of time left. Recap on the program and the importance on why it's important to get done early, and on things coming down along the lines that they need to look for.
Yeah, so you know, as we've stated here, vaccines are very important. They reduce illness, the spread of illness, not only among children, but in families too. And it makes for healthier schools, healthier children, healthier communities all the way around. So the CDC has the listing of school-age required vaccines, but then also, you know, vaccines that to keep your children up to date on a regular schedule, even for infants. Getting those vaccines in early will allow for us to get those taken care of if, you know, those accommodations open up with the Pfizer vaccine for younger children to be able to receive it. They can have your vaccine, and could potentially have the opportunity to receive the COVID vaccine as well before school.
Well, I look forward to seeing you next month with a new wealth of information that you provide for us. So come back and see us, will you please?
Absolutely. Thanks for having me today.
The Florida Department of Health in Polk County wants to encourage parents of all school-age children to receive all required vaccines early this year to keep themselves and other students healthy for the upcoming school year. Now, a vaccine is a dead or weakened version of a part of the germ that causes the disease in question. When children are exposed to a disease in a vaccine form, their immune system, which is the body's germ-fighting machine, is able to build up antibodies that protect them from contracting the disease if and when they are exposed to the actual disease. Now, if you need more information about vaccinations for school-age children, give the Florida Department of Health in Polk County a call at 863-519-7900, or look them up on the web at www.polk.floridahealth.gov.